Good morning, Dr. Anjana. How are you?
Fine, thank you. How are you doing? Nice to be back.
Excellent, excellent. Last time we talked about how the prevalence of diabetes is increasing worldwide, particularly in India. And I just wanted to ask you how the digital age is helping you as a diabetologist manage these patients and monitor these patients.
Well, digital is the new thing. So, with the increase in diabetes prevalence, especially in a low and middle income country like India, we need to reach more people. And I think one of the best ways to do that is through the digital means. So today we have the digital space that is helping us in prevention of diabetes, in management of the sugars, as well as prevention of complications of diabetes. So in every space, we do have the digital helping us. So it started off with things like SMS. That was a time when SMS was very popular, and it started off like that, which itself did show benefit at the time. But today we have progressed so much from that. And we have moved from plain SMSs, we have WhatsApp, we have videos, we have bots, we have social media, we have apps, we have all kinds of things we have today.
So let me
So
ask you, when you say, like apps and so on, I mean, there are more than 3,000 apps just for diabetes. So how do you, I mean, when you say this SMS and all that, are you talking about sending it to a healthcare provider?
no, so this was SMS to the patient. That
From the
was
doctor.
for
Ah,
yes, from the doctor. Nowadays, it's even educators or other platforms that help you, manage diabetes and things like that. So, yeah, so those kinds of things over a period of time, every day, did show some benefit in earlier studies from India. But your question was particularly with how it's helping, isn't it?
yes.
So, and there's so many of them. So we can basically divide them into those that are doing prevention and those that are doing management. So that would be like a broad classification. And then there are some that are talking about reversal and things like that. So, which you probably could put into management as well. So in the prevention space, there are thousands of apps. So each of those has, for example, for physical activity, we have apps. Steps, running, that kind of apps are there. Dietary related apps are there. Sleep, combinations of these, stress related apps. All of these are available. Do they work well? They do work if it's like I say, it's different strokes for different folks. So it depends. Or for certain people, these things work really, really well. So some people prefer one part of it. Some people like to do the combination of it all. But what I feel is that if you ask me overall, has it made a big difference? And it hasn't done. And I think the reason for that is not the app to blame, but it's basically what it's trying to do is trying to address behavior change. And that's not something that's easy for anybody. So not just those trying to prevent diabetes, but for anybody. It's so what typically happens is someone starts off on these programs, they do it really well for a period of time, maybe 3 months, 6 months, and then kind of just fizzles off, and then you're kind of back to. So I think it's not the availability of the apps that are there right now, but it's about how to create difference with these apps, how to keep them sustainable over time. So that's in the prevention space. Now in the
When you
management
talk about the
space,
fizzle out, are you talking about the program that you put in, let's say diet, exercise, whatever, or are you talking about using the app?
I'm talking about usage.
Okay.
So you do stuff like, so there are many things you can do. There are things, there are circles you can close. You set your own goals, and then just traffic light model. There's all kinds of things that you can do. And people are very committed to this for a period of time, right? But then life happens, and then they fall off a little bit, and then restarting that, getting back on that, let's say routine is where I think we still haven't cracked it.
So is there any particular app. I mean, obviously, you have to be kind of a little bit tech savvy, have a smartphone or whatever to use those. And, the data shows that it helps them manage, but just the compliance of sticking with it is maybe the problem. So, is there any particular more user-friendly app or a device that you have seen in your practice?
We're developing one that is
Okay.
helping. It's not yet in clinical practice and research right now,
Mm.
and we hope that that will help with the exact same problem that I'm talking about. Today, we don't have something to sort behavior change, but we do have people making life easier. For example, in the diet front. Before it was all about writing everything that you logging it in detail, and in Indian foods, as you know, that's really not easy.
Mm.
Today we have picture capture that does a fairly good job of all you have to do is take a photograph of your plate when you're eating, and you have whatever you need. So those kinds of things have happened. Physical activity recommendations are becoming more friendly, more easier. It's becoming more available to the public. Things like that. Sleep is available. Yoga apps are there that are helping with stress, mindfulness, meditation, etc. Because stress is like a central part of this also lack of compliance in behavior. So all that is available. Do we have an all-in-one? Not yet. People are still struggling with that.
Yeah, it would be nice if you could take a picture of your plate, and then another thing at the background is capturing, how many steps you've taken that day, and, or how much aerobic
Yeah.
exercise and sleep and all of it. If it captures at the end of the day, that would be
There
fantastic.
are there are now apps that are doing that. So automatically, it's capturing sleep. It's while you're walking, it's capturing step count. There are apps that are doing. There are accelerometers within your phone that's measuring all that.
I mean, they do
But there's still
separately, I know, but will they all combine with your,
no,
let's say,
no. There are
continuous
apps that
glucose? Ah.
there are apps that do both at the same time. But the problem with that is, see, for example, if you're an Indian woman, you don't, you're not necessarily carrying your phone on your body all the time.
Mhm.
So it may be in your purse, it may be something you may leave it on the table, etc. Then, in which case, you've lost data.
Or
So things
watch or
like this.
something, like a watch.
Yeah, so the watches are good. The Apple watches are good. Those are great. But the problem is, again, we don't have so much of Apple usage in India. It's more outside of India. Here we have more Android. 80% of people use, Android phones and not the Apple iPhones. So we don't have that syncing. But those are good. The watches are good. They do a lot of it, actually. They do heart rate monitoring. They do sleep. They do physical activity. So there are ones that
Probably
are
even
doing.
see, if you have a CGM, continuous
Yes,
glucose, it will
there are
also come
apps
to the
linking.
watch.
Yes,
Yeah.
you're right.
But
Which takes me to the management.
do they
Which
integrate all
takes
of it and give you something at the end of the day, like
yes.
your glucose
So
was this, everything?
yes, there are apps that are doing that. Well, we still haven't. Well, it's not freely available in clinical practice. There are so many. There are still some accuracy issues. Are with linking a lot of these data together. But I think we're cracking that very soon. One of the good ones is actually Apple. It does a lot of the stuff for you, but it even does some ECG and all that. So it's there, but is it available freely in clinical practice in India? No, it's not yet. And we're still, but there are many, many people working on even simpler tools now, actually, without, the taking newer features and models into consideration.
So what's your, dumb it down? What's your recommendation?
So I haven't spoken about the management apps.
Okay.
So this again, there are many types of apps here, and I think the primary one helps with insulin dosing. So you can look at various insulin dosing. It helps you. For those who are older, can't remember. It helps with those. It helps with various other things for prevention, and it helps you with multiple pill usage. It helps you with your appointments. It helps you with your purchase of medicines. Lots of things. Apps are helping nowadays. It's linked. There are smart insulins, there are smart pens, etc. So this links with your app, and it can accurately monitor. There are CGMs, which are continuous monitoring glucose devices. These have progressed quite a lot now. We have in-range values. So for each person, how much percentage of time is spent in range is essential to know what that person's risk for complications will be, etc. So those are very important as well. We have the artificial pancreas, the pumps that have come in. So those are revolutionary for those with type 1 diabetes. So you have the CGM and you have the pump on the same person. These are talking to each other. So every 5 minutes, glucose is monitored. And based on the sugar level, insulin is automatically released from the pump. It requires very little information from you, maybe just what you're eating or something like that. Carb alone, you enter. The rest of it, the pump actually does on its own. So we have really good management devices in the digital space.
I know that continuous glucose monitoring, I mean, they do quite a bit here, and I know I've seen that your clinics do that as well. I know it's kind of, there's expense involved in it, changing the sensor every couple of weeks. And then, if you don't have insurance or if you're paying cash, it's could be pretty significant just for not a treatment, but a monitoring device. What is the rate of usage there, and what do you feel about any one or
Uh,
the other?
So here it's mostly prescription prescribed so it's physician prescribed at the moment. So it depends on what the CGM is for. Typically, if there are hypos that are coming, or glucose, you have abnormalities in A1C that we need confirmation, the glucose and the A1C not matching, etc., etc. So we have a whole range of uses for CGM, and only those we prescribe. And once you prescribe, then it depends on whether the patient can afford it. It's completely pay out of pocket here. We don't have insurance for this at the moment, so it's pay out of pocket, and because of that, it's limited by how much they can afford. So it's obviously not available to the lower, socioeconomic strata, middle, upper middle, high income.
Do
Again,
you,
depends.
in very compliant patients, if they can't afford using it on a continuous basis, maybe they could use it for a couple of weeks and you can figure
Yes.
out, and
Yes,
then they
we
can,
have a
yeah.
protocol that talks about intermittent CGM usage. So, at periods of time. So, once you use it for 2 weeks, the value is valid for about a month. So, we use it for different periods, maybe a couple of times a year, etc. We also do various other things. It has 2 weeks of validity. So, we are able to do 1 week. We do dose change and look at it in the mix. So that way also we are able to maximize the usage of the CGM so that the cost doesn't go too high.
And if they're disciplined, they can probably follow the same
They can.
dietary
It's not
regimen. And
it's not
yeah,
needed for everybody,
yeah.
So stable type 2 diabetes on oral tablets, possibly we don't need it so often. It's more for those taking insulin, for those older, younger, etc. So those kinds of special situations we do use it quite a lot.
And I mean, there are few companies that make that. So I guess all of them are pretty
Cost is
equally.
a problem. At
Yeah.
the moment, we only have one very viable company here. There's only few in the world itself, but in India, we only have the cheaper ones have been withdrawn. Only the expensive ones are there. But the good news is, us included, we're working with people to bring out low cost CGMs. There are multiple companies that are working towards this. Today, we are still we're working on accuracy issues. We still haven't sorted that out. But cost, we have done, sensor availability, all of that is there. If the accuracy, so the trials are ongoing. If the accuracy issues are sorted, we will have low cost CGM, which will make a huge difference for those with diabetes.
I mean, I've noticed with some of the patients that um, it'll give you a low glucose alarm, yet the patient, um, doesn't have any hypoglycemic symptoms, which may be because of the diabetes, but truly, I don't know what the sensitivity is at the lower levels. Maybe it's being more cautious.
Yeah, which is probably a good thing because you don't want it to go so
Yeah.
low. The ones we have right now don't do any alarms. It just gives you a value. But of course, if you have the app on it, it does do that. You're right. But if, yeah, so it's up to you though to, unless you're on a pump, which automatically suspends, then it's up to you to take action on that alarm.
Yeah, I mean, I've seen some patients say that, they go and eat, because it's saying it's 70 or 69 or
Right.
something like that. And then it goes up real high and they say, so sometimes, but you're right. You don't want to take a chance with low glucose.
Yeah.
Yeah.
And I mean, if that's happening too, see, you would expect it to peak a little bit on that day. But I think the important thing then is to figure out why it's going low.
Mm.
If it was a one off or something is happening in which there is a dosage change that is needed, a medication review. So if that's happening often, then you need to see your physician again to see that that is comfortable, or if there is something else going on that requires. If it's a one off, that can happen to anyone, but yeah, if it's on a regular basis, then you need to get
A
that
regular
checked.
basis on a particular time, then it may be the
Yeah, then
medication
you know that
dosage.
something is going wrong.
Yeah.
So but you can correct it.
Yeah. Yeah, that's good. So that's wonderful. Did it make your life easier or harder having all this information
Oh no, it's much
as a
easier.
physician?
It's
Yeah.
Oh yeah, it's much easier because especially if you have CGM data, now we have pictorial representations of this, right? So easy. Over a 24-hour period, which part of the day the patient's sugars are spiking, which medication or which insulin dose needs to be altered. It makes life so much easier. But that is from our side. From the patient side also, if they have real-time CGM, then they know, okay, if I eat upma, this happens to me. If I eat dosa, this happens to me. They're very good with, and there are some
Good
patients who are
feedback for
really
them.
good.
Yeah. Good
They were
feedback for
good
them.
with it, and
Real
they know
time.
how to
Yeah.
use it well. Yeah.
Excellent, excellent. So I think it has really revolutionized both for the healthcare provider as well as for the
Yeah.
patient. So
For us, though, we do
Mm,
have some other things that we use as well.
mm,
And so this we call as the 3D digital diabetes care.
mm,
So it's three Ds, like D, D, D. So the first D is called Dia, which stands for light or lamp. And what this is actually a chatbot. So each of these actually are avatars
mm,
of various, things.
mm.
So the first one is a chatbot. It's AI enabled and it gives you information. So, in our space of treating diabetes, knowledge is power, really, and empowerment of the patient is key to getting control. So, they need to know stuff about diabetes and insulin, sick days, etc. So, all of this is available on the bot. So they can do it at their convenience at any time. And if they have stuff that they need above and beyond, they can always contact a human being. But this makes their life and our life also easier. So that's the first one. The second one is called Diala. It's the Dr. Moon's main app. So here's an app that's going to do a lot of the stuff for you. So in addition to looking at so every time you come into the hospital, it's linked with all the lab machines, it's linked with the computer HIS systems, etc. So the minute you come in, your reports get onto your app. In fact, patients see it before even we see it, because once the report is ready, the lab machines are integrated, automatically it gets to the app. So you can see your reports, you can see over time what's happening, you can look at your prescriptions over time, you have direct contact to your doctor, you have emergency services, you can speak to a dietitian, you have a diabetes shop, you can buy footwear, jam, jelly, whatever you like. You have your own BMI monitoring. So you can do this whole my diet is this, my sleep is this, my sugar is this, my response to drug is this, whatever. So you can do your own. It has the whole entire gamut there. So that's very useful. Patients find it very useful, particularly for ordering their medicines, for keeping their appointments. It gives you reminders. It does stuff like that. So that makes it very.
We
Also,
have
the
here
other thing
like
that
my
is really,
chart. It's called my chart. So any
uh-huh.
patient can go in and look at all the things that you're saying. The lab, uh, you know.
Only the patient. No one else can access it.
Yes, correct.
Yeah. So the other thing that they can do is they can also order the labs to their house for home delivery. So if someone is coming to pick up the blood, then you can follow the Swiggy model, where
Yes.
there's a map and it tells you where the guy is, and you can because you're fasting, you want your blood to be taken on time. So it allows you to do that, contact the guy who's coming to the phlebotomist to take blood, etc. So it's that way a very useful thing for the patient. But the third one is the most exciting one, and that's for the doctor. So that's called Diana, and it stands for Diabetes Novel Subgroup Assessment. So what that means is that all type 2 is not the same. There are subtypes of type 2. So those with the insulin deficiency, those with age related, those with obesity related. So there are many subtypes like that. And when a patient comes in for the first time to the hospital, I already told you our labs are integrated with our digital systems. So automatically the tool takes 8 parameters into consideration, things like age, BMI, lipids, your C-peptide. All of this is automatically integrated into the tool, and it gives the doctor the diagnosis, basically, which subtype of diabetes that person is dealing with. Also, it gives for that particular patient 5-year risk of retinopathy and nephropathy. So kidney disease or eye disease. So in a resource limited setting like ours, which one you need to follow. It's also good for the patient to know which one they have the highest risk of. Not everybody has risk of everything. So depending on their subtype, which complication the doctor should follow, patient should be aware of, etc. is very useful for us. Also, it gives you some idea about medication. The medication one is not still fully mature in our system, but that is coming really soon. So this helps us, and even in a primary setting. So the idea is that, see, we are a specialized center. With or without the tool, our doctors will still do it. But in primary care settings, it's easy for the physician sitting there to know which kind of diabetes they're dealing with and give the right medicines. So it's
So this
precision
is
medicine for diabetes.
3D is an app that you, Dr. Mohan's clinics developed, and you are using it, or it's available in public space?
The 3 separate ones. So one is an app, the Diala. One is a WhatsApp-based chatbot, that's Dia, and the other one is a precision web tool, Diana.
That's your tool, yeah. Okay.
Yeah, it's a web-based prediction tool. So that is so that they're not all one app. But yes, well, right now it's if for IP purposes, it's still not public, but we do plan to make it once the patent is done. It is developed in-house. Yes.
Okay, so there are 3 separate ones for
Yes.
different purposes. That's fantastic. Correct. That's very good news. I mean, if anyone should develop, India has a need and the expertise as well. So that's a great news.
So it's actually precision diabetes care.
Yeah, that's what we need. Okay,
Yeah.
that's great news, and thank you very much for spending time with us, and we'll catch up again on other aspects of diabetes.
Sure.
Thank
Thank
you.
you.
Bye.